Hello, my name is Jane Norris, and I'm a student at the University of Texas at Arlington, enrolled in the MSN Administration program. I will be demonstrating the use of role play as a teaching learning strategy in the presentation and communication technique called AIDIT. This presentation is in partial fulfillment of N5309, Teaching Learning Theories, Strategies, and Evaluation for Dr. Wendy Barr. The audience for this presentation is nursing staff in the setting of a unit meeting. As a unit educator, I have been enlisted to help improve service scores by reinforcing the use of the evidence-based communication technique called AIDIT. AIDIT education is part of a hospital-wide initiative to improve service scores. Thank you all for your time. Hi, my name is Jane Norris, and I'm the educator for critical care and acute care services. I've been a nurse for over 20 years and have been the educator here for the last 6 months. Your manager invited me tonight to talk with all of you about AIDIT. We discuss and teach the use of AIDIT during new hire orientation, so this information will be a refresher. I will first review what AIDIT means and why it's important to you as you take care of your patients and their families. We will then have an opportunity to role play and practice our own use of AIDIT. I value your time, so we'll make sure that we're done in the time that was allotted by your manager. Thank you all for attending this unit meeting tonight. Okay, did anyone recognize the communication technique that I was just demonstrating?
You were using AIDIT.
Great, thank you, Ron. That's right, I was using AIDIT. So let's go over what AIDIT is. A is acknowledge. We need to anticipate our patient's needs, knock before entering the room to show respect, greet, smile, make eye contact, make patients feel welcomed and appreciated. I is introduce. Tell them your name, your role, your department. Briefly tell them about your background and what makes you qualified to take care of them. Expand the introduction to others on the team and to the physicians who treat them. In this way, you are managing up, setting the stage for your patient to have a smooth, anxiety-free transition from caregiver to caregiver. D is duration. Time is important to all of us. Tell your patient and family members how long they will need to wait, how long before the anticipated test or procedure, appointment or admission, how long will it actually take? How long before results will be available? And most importantly, how long before they can go home? And if there are delays along the way, be sure to keep the patient informed of the additional waiting time. E is explanation. Use simple and understandable terms. Tell them what you are doing and why you're doing it, what will happen and what they should expect. Ask if they have any questions about what you just explained. Gently encourage them to say in their own words what you just explained. Remember that patients only remember 30 to 50% of the information that we give them, even when we use simple terms. And then lastly, T is for thank you. Thank your patients for their cooperation, their communication, and for allowing you to be their caregiver. Thank their family for their assistance and for being there to support the patient. You guys know that with consistent use of AIDIT, your patients will leave feeling good about the experience. Those good feelings will translate to improved patient satisfaction and loyalty. AIDIT is a skill that needs to be practiced. Remember the AIDIT letters to make this one of your most important tools in delivering service. Okay, now for the fun. Let's break up into groups of 2 or 3 and let's begin the role play.
Good morning, Ms. Gomez. My name is Jim Smith. I'm a phlebotomist in the laboratory, and I'll be drawing blood from you today. I've been in the laboratory about 10 years, so I've done thousands of these. I'm going to take great care of you. Your doctor wanted us to draw some tests to see how you're doing today. This will take just a few minutes, but for your safety, will you tell me what your name and date of birth is while I check your armband?
Yes, it's Rachel Gomez, and my birthday is May 17th, 1982.
Thank you. We want to make sure that we draw the blood from the right person and get the correct test. I'm sorry, but this will take a big stick in order to draw. We have some special tests to do, and then your nurse will come in and give you some medication, and then we'll come back and draw some more tests to see how the medication's doing. Thank you very much for choosing our hospital for your care. Is there anything else I can do for you before I leave? I have the time.
No, thank you.
All right, y'all did a great job. So, Rachel, how did it make you feel knowing that Jim has done this for over 10 years?
Well, from the patient perspective, I was comfortable and relieved, and it definitely made my anxiety level go down about the treatment that's going to happen.
Good. And Jim, was it easy to use AIDIT?
Well, not at first, but I went by the script, and that's why it's a skill that we have to practice.
Very good. Thanks, you guys. Everyone did a great job. Thank you all for your participation. Is there anything I can answer for you? I have the time.